So what I'd like to chat to you about today are the cranial nerves in charge syndrome. I've got a lot of passion for the cranial nerves. They are extremely important. I'm hoping with this presentation that at the end you'll be as enthused by them as me. You'll see areas for more research, and certainly you'll have a feeling that although they're sort of a hidden part of charge syndrome, they come out in all sorts of aspects of the clinical aspects. And really, that's why my passion has been to include the cranial nerves as a part of the criteria for charge syndrome and as one of the major features, such as, you know, coloboma and choanal atresia, the cranial nerves. So let's start with a little bit of anatomy. We've got 12 pairs of cranial nerves. It's great that we've got pairs, because if one doesn't work, the other ones pick up, or if the pair doesn't work, some of your other cranial nerves pick up, which it's a very interesting way of a system to work. So they back each other up in many ways. So those 12 pairs are given lots of interesting names, if you look down at the names, they don't give you a lot of information of who they are. The seventh cranial nerve, it's all in Roman numerals, is the facial nerve. That gives you some information there. And one of the ones I'm very, very interested in is the vagus nerve, which is the 10th cranial nerve. So when we look at the function of the cranial nerves, so looking through the function and the symptoms of dysfunction, I've related those to very much to charge syndrome. So if we go down from 1 to 12, we've got the olfactory, which is your first cranial nerve, mediates the sense of smell, and you can have what's called anosmia. You could have no sense of smell, you could have reduced sense of smell. We know that that's actually very important in charge syndrome because it relates also to puberty later on. And that's because of the embryonic where that cranial nerve developed from. So as we go down and we move down the cranial nerves, you'll see, and I'm going to take you through those as we go through each one individually. You'll see that the group at the bottom, which is the sort of the 9th to 12th, are sort of all located quite in a very similar area together on the brain stem. So we sort of look at those a little bit as a whole. And then you've got more specialized cranial nerves, such as the 8th, which is to do with the hearing. So what I will do now is that's an overall picture, and that's a good little table to have out and to have visualized, because you can sort of follow through what happens when that cranial nerve doesn't work as well as it should or is not working at all. So if we look at the brain stem, if you look at my head here, and if you turn me up that way, you'll get my brain stem underneath. And that brain stem is actually protected by your head, by all the muscles around the upper part of the neck and head. And you've got the cranial nerves coming from a very, very, very small area, very well protected, and they're coming off in pairs, so they're easy to see, and on the diagram you'll see them in yellow, and as they come off in their pairs, again they're very protected, and then they go down to different parts of the body to either supply information down to the body or take information from the body. So they're the collectors of that information. So really they're the central processing system of they're reaching out, collecting, and then coming back to the brain, processing, maybe sending orders down again. So to visualize it that way, it's very, very simplistic, but it's a very motorway feeling of the traffic going down and the traffic coming up. So our first cranial nerve to talk about will be the olfactory nerve, which is the one which is the sense of smell. Why I said this was important, it's important for us to smell. It's part of our mechanism for, do we like something, do we not like something, avoidance, but it's also with this cranial nerve, when it was developed around the area of the hypothalamus, and that area is the area that has some of the control over your puberty development. So the pituitary and hypothalamic hypothalamus area. That's a very important area. So you've got your nerve that controls smell growing from that area, and think about it, if that area is not developed properly or something happens, something's happening to your sense of smell, and also something's happening to your puberty. So we know that the individuals with charge with no sense of smell have 100% chance of not going through puberty. So that becomes it becomes harder to test for sense of smell, but that's a good indication that something's going to be up and problematic with puberty. So that gives us a little sort of thought for the future. Then we look at the cranial nerves for eyes. So we've got essentially 4 of them involved. Eyes, as you know, mostly we think about the coloboma, the front of the eye, at the back of the eye, and cranial nerve 2 is called your optic nerve. And that really looks at taking messages from the back of the eye over to actually the back part of the brain, processing them and bringing them back. So number 2 is very much involved in that the pathway that goes between the back of the eye and to the cortical area of the brain. Now, we know that that's very affected in charge syndrome. Often, what's interesting is eye doctors will say, oh yes, there's going to be very little vision, and then, oh wow, there is actually good vision. So they have no idea half the time right at the beginning what's really going on. But at the end of the day, we know that that nerve is probably affected, but it's more likely it's affected at the entry point, which is at the retinal point. Now, the other nerves, we've got the nerve 3, 4, and 6. So 3, 4, and 6 control your eyes going left, right, up, down. It controls a lot of your, as well as the movements of the eyes. There's a lot of sort of the focusing issues around tracking. And we know, again, in charge syndrome, that tracking can be very, very affected, or it can be affected to the extent that other things take over to try and help, which may be head movements, which may be looking in different directions. Now, these nerves haven't been given a lot of press, but we know that there's probably more going on with them than we actually have been able to research to date. It is well written in the literature. I've written one of the papers with an ophthalmologist here to say that they're really not involved much. I'm beginning to question that, and I think that the questions could easily be answered through more research. But again, it would make sense with the other cranial nerves being involved, that these are more involved than we actually think they are. So, and I think that's been the story right the way through, that the cranial nerves that were thought to be highly involved, such as, say, the one for hearing, yes, we can tick that one off the list, but many years ago, nobody really thought that there was anything going on with the sense of smell. So we're beginning to get information as the research is done. So you'll see I've skipped one, which is your 5th cranial nerve, which is your trigeminal nerve. Now, this is a very interesting nerve. This is the nerve that's very sensory to the face. So it's really looking at the face in 3 areas: sensory to the sort of the top, the middle, the bottom area, and there's this nice schematic diagram for that. But the trigeminal nerve is very important around those facial areas. So with the trigeminal nerve, you've also got the muscles that control what we call mastication, which is your chewing and your swallowing, and your, not so much the swallowing, but more the chewing and the stuff that's going on around here. So it's interesting when we test for that. We often say, can you clench your teeth? Can you do that? And you can sort of feel for the muscles clenching there. We have some very rudimentary tests to test for these cranial nerves, which look, when a neurologist does them, they look fantastic, but they're very rudimentary. So the trigeminal nerve is definitely involved. We know that from actually knowing that the chewing and the power is not there. It's a range. It's a range, like there's a lot of things from normal to very abnormal, very low power or not working. I have a wonderful story about a little girl I met on the ward, and I was the attending. She had diarrhea and vomiting, and I went and looked at her, and I thought, oh my goodness, I'm seeing charge everywhere. I thought, she's got charge syndrome. She was only 8 months old. So I went and took a history, and I said, anything different or worries you? And the mum came out with a few things. She said, do you know what, Dr. Blake? She doesn't feel sand going in her eyes. And I said, can you explain that a bit more? And she said, well, she comes home and we look inside her eyes and she's got sand in there. She's not feeling it. And she just doesn't feel, her eyes aren't feeling properly. So to cut a very long story short, we did the investigation, we did the genetics. She had a very mild facial palsy, which gave it away to me. She also had this, which was called trigeminal involvement, so she couldn't feel the sensation in the cornea. We did publish her as a little case report, and I will make sure that that's included in our references and on the slide. But it is a wonderful, I think, indication that you've got to be looking out for the other things that are hidden. And charge is a great trick box of hidden things, which has always been, as a general pediatrician, my love for the families, the conditions. They have things hiding there, and we've got to find them. So that's our trigeminal, very interesting cranial nerve. Again, very little research has been done on it. Feeding issues are so prevalent in charge syndrome. We all know that, and there's certainly a link, we know, between the facial nerve, which is the 7th cranial nerve, and I think probably the facial, including the trigeminal, the 5th and the 7th, are probably very linked to knowing that there's problems with chewing, swallowing, feeling, sensation. So your facial nerve is very, very obvious to see. That's an obvious one. So we know that some of the kids have got one side affected, or the other side, or both sides, which actually, when both sides are affected, if they're mildly or more than just mildly affected, it can actually show a face that's got not much expression, and that can be very hard for those kids as well, because they're not able to show their expression. But the one-sided expression face is very obvious, and is often one of the key features that is noticed by a parent when their child is born or soon afterwards, and it's one of the pointers in. Meg Hefner will say, and that's a pointer, the ears are a pointer. Those are sort of the obvious pointers. So the facial nerve is involved in taste, as well as some sensation. Certainly we think around in the oral cavity as well. It's very much involved in the motor side of the face, in how the face is the movement of the face. So one of the tests we do for facial nerve, we ask a patient to screw their eyes up and not let us open their eyes like this. So that's again a rudimentary, crude test for facial nerve. The facial nerve can affect the sort of, again, the upper part, the middle part. It branches out to different parts of the face. Another important part of the facial nerve is to do with salivation. Saliva and the making of saliva is interesting, because people always think there's too much saliva around. There's probably not too much saliva. It's actually that the swallowing is not happening. It's there, and the swallowing and the dealing with the saliva is not happening. So again, that's a very interesting part of the facial nerve as well. So what I'd like to do is move to the lower cranial nerves. So in the lower cranial nerves, we've got the cranial nerve 9, 10, 11, and 12. So what's important about these are they are really traveling more to the lower parts of the body. So we're now, the lower cranial nerves go to the lower parts of the body. So they're actually more in control of the visceral functions of the body. So think about things like heart, lungs, gut. So those are the ones that produce some control, some in the more the upper part, the lower part. So they are now going, they're coming from one area as well. There's been very little research on none of them much except for the 10th cranial nerve. We've done some research here on that. But essentially that control is through also autonomic nervous system. So there's another nervous system which is very autonomic. And part of that is very, well, it's hugely important for the running and the controlling of the body. So that's the body environment. Now we get many parents that say, you know, I'm not sure that the kids can temperature regulate properly. What about the pain that's going on? All of that is probably linked to some of the autonomic nervous system. And there's certainly been a lot of interest regarding that from us lately. But what I'll do is I'll track back to the cranial nerves and try and bring that sense of what's happening with the autonomic nervous system as well, which is again part of our central control. So the 8th cranial nerve, this one is well known to everybody in the charge field. I mean, it's been given, there's such a lot known about it, I hardly need to talk about it, but essentially it's your hearing and your balance. So your 8th cranial nerve is giving feedback into your semicircular canals, into the cochlear. It's receiving from the ear. You're getting the sounds traveling through. So we know it's very, very, very affected, and there's a broad range of it being affected. And again, those are, as with the eyes, the ears is a whole talk of its own. So that's your 8th cranial nerve. And then we move on to the lower cranial nerves, which certainly are very, very interesting to me. If we take them in order, the 9th, which is your glossopharyngeal nerve, so your 9th cranial nerve. So the 9th cranial nerve is affected by mediates taste, salivation, swallowing, and some visceral function. When you see the visceral function, that's more the autonomic function. That's the function. Autonomically, we swallow. We don't think we've got saliva in our mouth. We just swallow it. We don't think, I've got too much saliva there, I've got to swallow. So that's where that 9th cranial nerve, the glossopharyngeal nerve, it's got a lot of autonomic function that's happening. So it's probably part of that function that's not happening properly, that's producing some of the problems with swallowing. So we know that the problems with feeding and swallowing and eating are more than likely related to a good part to the cranial nerve abnormalities. There's not been a lot of research on this, really nothing. So this is a nerve that needs more research doing to it. We've done some of the research on the 10th, but I think it needs to be repeated, or some more needs to be done with the 9th as well. So I can't say that is affected in charge, but I think if you're listening to this presentation, you're going to say to yourself, it's more than likely that something's going on with that. And we know that there are problems with swallowing, with salivation, with those things, even taste. And the more we can actually, again, work through with that, perhaps the more we can actually say, right, do we need to think about implanting that nerve, having something that will actually make that nerve work better, so the swallowing and the saliva doesn't get pulled. So that's your 9th, and the 10th really takes over from the 9th. It really does. Your 10th is phonation, which is how you move your mouth to different sounds, swallowing. But the biggest thing is visceral function. And it's very interesting because people would actually test for the 10th and look for the gag reflex. That's such a primitive way for looking at it. I mean, most people will have some sort of gag reflex, but is it a normal reflex or is it an abnormal? And that's a reflex as well. Whereas actually the 10th will have some things that are reflexed and some things that are autonomic and some things that are in our control. And when we look at the 10th cranial nerve, you can see how far it goes. It goes from the brainstem at the top, it spreads right down to the intestine. So it's got a far, far reach. And given that far reach, we know, and we've done the research now that shows you that those enteric nerves, those nerves that are at the bottom end of the 10th, which they go to the gut, they're not there, or they're there, but they're not there in enough quantities. They're not working, they're not functioning as they should be. So given that the cranial nerve 10, we've touched on it, it also goes to the gallbladder, and we know that there can be gallbladder problems in Charge syndrome as well. We also know that there's more than just digestion. The enteric nerve sort of does a lot of pushing things along in the gut as well, but we know that there's a lot more that goes on in the gut, and we're still very, very keen on doing more research in that area as well. And then if we move along to the 11th cranial nerve, and this mediates this is the called the accessory nerve, and this mediates your, we're now going back to sort of head and neck and shoulders and muscles, and there's been a good paper by Connie that's done some research on that, looking at that nerve being involved. Again, we just looked at the kids having sloping shoulders or abnormalities with a scapula, but we very much feel that that's related now to the 11th cranial nerve. So really, 10 years ago, 15 years ago, a couple of cranial nerves seem to be involved in Charge syndrome. Now you've got a whole span of probable involvement, and now we're trying to prove that through different bits of research. The last cranial nerve, which is the 12th, is hypoglossal. That mediates the tongue movements. And again, I've got a couple of little kiddies with Charge syndrome that if you actually look at their tongue movements, one of the mums said he can't get his tongue to the left. He really can't move it to the left, that you can actually see that. And again, there's been very little written on that, or very little press about that. It all has an effect on eating, swallowing, all those problems that we know are quite prevalent in Charge syndrome. So we did a piece of work some years ago now, this is actually 2003, it feels like a very long while ago, where we were one of the first people to actually sort of say, there are problems with more than just the regular cranial nerves, that such as the hearing and the facial nerve. What about the others? So we looked at particularly the other lower cranial nerves that were affected in swallowing and affected in the function of swallowing and the gut areas. And we actually found that the cranial nerves were much more affected than was really being seen by other people. So we saw Charge syndrome much more as a cranial nerve condition, more so than a condition where there was lots of things sort of disjointingly affected. So if you think of it as a cranial nerve condition, actually what I've just gone through makes you think much more, that's why things aren't working. So we found that there was an increased frequency of cranial nerve involvement once you started to look for it, and then the likelihood of cranial nerve dysfunction was more likely if you had the facial nerve involved, and it was more likely also if you had swallowing and feeding problems. So I think what we said was, once you start getting one or two, look for more to be involved in the patient. So I think what I'd like to do is just turn to the summary of that paper. So the apparent, the dysfunction of cranial nerves is more frequent and more multiple than people realized. The extent of the cranial nerve involvement certainly does reflect on the clinical spectrum, and we've sort of proven that with the vagus nerve. Eighth cranial nerve, your facial nerve, more likely to have other cranial nerves involved. And the fifth cranial nerve is affected in Charge syndrome, which I didn't think anybody thought was affected at that time. And really, since we've done this research, we've gone on to prove that the 10th cranial nerve is very much affected, which I think is quite something, because really nobody was looking at the 10th cranial nerve at any point in time. Because interestingly, you can't see it like you can see the facial nerve. You can't perform a test like you can with the auditory nerve. So I think that's quite a lot to digest. I would point you to the papers that we've done. I think there's some really good work out there around, particularly now the vagus nerve. I'd like to make a little plea. We're doing some new research on the microbiome, which you've probably heard a little bit about, which is what's actually going on in the gut, what is happening to the digestion in the gut, the bacteria, the good and the bad bacteria. I think that's going to be fascinating, and we are still in the stage of collection. We are increasing our population to the adult population, which is going to be we had a lot of requests for that when we were at the last conference. So we are looking at the gut itself and what's happening in that microbiome. Because if you've got a gut that's not squeezing and functioning and not pushing along because the cranial nerves aren't doing that bit, they're not doing the motor function, you've got a bit of a stagnant gut. So that gut's probably not happy in there, and can we change the environment in there to make it better and hopefully improve symptoms of gut disturbance. So I direct you to my website, which I'm really, really, really proud of. It's going to have all my papers on it. You can dip in there, dip out, download them at your will, and if there's other things you want me to put up there, let me know. It's for you. I've been asked to do this many, many years ago, and I'm proud to say it's launched this year. And I think it's very easy to navigate. It's not got a lot of extra stuff on it. It's really got mostly all my Charge stuff on there. So thank you very much, and I look forward to chatting to you again. Bye-bye.